Hi, everyone. Today's webinar is What Does Vision Have to Do with Healing from a Brain Injury? My name is Dr. Trinka, and I'm an optometrist and a certified nutritionist. I'm a neurooptometrist, so I'm a bit different than a standard optometrist, and that I look at the neurology of what's going on between eyes and brain. I'm a certified nutritionist and have been for over 20 years. I'm a syntonic optometrist, which means I use light and color and different frequencies of light to go ahead and to shine through the eyes to affect the brain and to balance the what is called the autonomic nervous system. And most people with a brain injury are in a significant fight or flight state. I've got over 30 years of clinical experience in helping people with their eyes. So that's enough about me. Um, so, one of the major questions that is super important when you start helping a person with a brain injury is how they process their visual environment. So, how you process the visual environment is based on a number of questions. And the first question is, of course, what am I looking at? And each question relates to part or parts of the brain. And so the first question is what am I looking at? What is it? And the second question is where is what I'm looking at? The third question is where am I in relation to what I'm looking at? And the last question is how am I? And let's talk about this a little bit. So this series of questions was developed by an optometrist that over 70 years ago, and he was, when he started out, he was in the middle of the country, and his patient base was a bunch of farmers, and they would come in for an eye exam, and he would do a normal eye exam and send them out with glasses, and they would come back to him and say, "I can see clearly, but I plow my rose crooked." And so he thought, there must be more to the way a person processes their visual environment other than just sharpness of eyesight. And so over time, he developed this model of what he called emergent vision, and it has to do with these questions. And most neurooptometrists follow this model to try to figure out what part of the brain is affected and how to help it. And so um, I want to talk a little bit about how am I, because it has two different aspects to it. There's the aspect that says, I'm happy, I'm sad, I'm fearful, I'm joyous, or whatever. And this affects your visual perception. And your visual perception affects how am I. When I'm fearful or afraid, my peripheral vision tunnels down, and so I don't see peripherally near as good as when I'm happy or joyous. So how am I is a modifier of all of these other questions, and I think that's an important point. So the eye is connected to the lot, and if you've seen any of my previous webinars, you know this is one of my favorite slides because it just shows you that this is not only about seeing clearly. There's a bunch of other brain areas that connect to the eyes and then connect to other parts of the brain to bring you sense of your environment. So the first part of the brain that we want to talk about is the occipital cortex. This is essentially where images are formed. So another part of the connections between the eye and the brain is the brainstem. And in the brainstem, this part of the brain, which controls all of the unconscious activities of the body, like breathing and heart rate and respiration, all these things. There's a couple of places in the brainstem that are incredibly important, and they are called the colliculi. And there's a superior and an inferior colliculus. The superior colliculus is in the brainstem, and it has to do with vision, and the inferior has to do with auditory. There's a really brilliant eye doctor in Chicago, and I have a little quote from her, which I think is really, really useful, and it has to do with this retinocollicular pathway. And I want to read it because it's so powerful. Um, and this doctor's name is Dr. Zelinsky, and here's what she wrote. While the constant interaction between the peripheral, where is it, and the central, what is it, pathways allow a person to process and organize information in their environment, it's the balance, the where am I pathway, that is the most important in neurooptometry. This is the retinocollicular or balance pathway, and it's the foundation for the work performed on patients. This reflexive pathway is the fastest to the brain, and it's the first pathway in which sensory integration happens. If it is not in balance, the person's spatial orientation will not permit proper environmental interpretation. So in other words, you cannot interpret your environment very well unless this part of the brainstem is functioning well. But this is ultimately the stuff of neurooptometry. If you're not balanced and you don't have a sense of where am I relative to everything else, then nothing else makes sense. And you're going to struggle to deal with the mismatches between your sense of balance and your sense of vision, your sense of balance and your hearing, your sense of balance and your mood. The things that are challenges for a brain injured patient have to do with mood, posture, hearing, memory, body chemistry, reflexes, emotions, sleep, and auditory processing. And all of these things are influenced by your balance. Who knew? So once the signals go from, and 80% of the signals from the retina go to the visual cortex. From the visual cortex, it sends information out to different parts of the brain. The parietal lobe has the dorsal stream, and this is associated with processing and integrating your sensory input. So not only vision, but taste, touch, smell, all of your senses. It gives you a sense of where things are. And like I said before, it's the dorsal stream of vision. When the parietal lobe is affected, generally your sense of where things are is altered. And so this creates a mismatch, which causes a bunch of symptoms. So in addition to the occipital lobe and the parietal lobe, you also have the temporal lobe. I just alluded to this, and the temporal lobe is a lobe that has many functions. It makes connections to the limbic system, which is at the base of the temporal lobe. And there's auditory processing that happens here. There's motor for speech, so how you can speak correctly and not make gibberish. And it also the processing of the emotions. So the temporal lobe is often thought of kind of a how am I kind of a lobe, in addition to this ventral stream that has to do with where things are. The last lobe I want to talk about is the cerebellum. And the cerebellum is at the base of the brain. This is exceedingly important. I think literally it means little brain. It's unbelievably important in all of daily life. It's also involved in memory and also in learning. And so, of course, we'll see that on the next slide, that the cerebellum deals with fine coordination, balance and equilibrium, and kind of this, along with the brainstem, gives you a feeling of where am I? So there, as you well know, if you're listening to this, you know that there are many symptoms related to a brain injury. So an enormous amount of symptoms that are related to a brain injury. So which ones are related to vision? Out of all of those, which one can vision be a part of, and therefore can vision help? All of them. That means that you can use your visual system to go ahead and heal some parts of the brain that are affected by a traumatic brain injury. In fact, most parts of the brain. So most common areas of the brain injury when you have a concussion are the parietal lobe and the cerebellum. Certain deficits in eye movements are always related to certain parts of your brain. And this is one of the ways you can help diagnose, based on eye movements, what part of the brain is affected. If it's really, really recent, you're probably going to be dealing with the opposite side of the brain. If it's more long-term, you're probably going to be dealing with the side of the brain that got hit. In any case, you can look at eye movements to try to determine how dysfunctional they are and what part of the brain is involved. And so I want to show you a picture of a right eye. And obviously you want to be in this area on the top where it's in green between 70 and 85, called functional. I have yet to see a person who has had a brain injury that is in the functional range. Could be 60, could be 70. Oftentimes it's what we're seeing here, 19. This is completely dysfunctional. And there are three kinds of eye movements that this machine looks at. Your ability to follow an object back and forth and up and down, your ability to jump from one point in space to another, and your ability to just hold your gaze. Look at how this person's right eye is tracking from right to left. I mean, the left eye is not great, but at least it goes from target to target. It overshoots on the right side and it undershoots on the left side. But this right eye is crazy. I want to direct your attention to the top right portion of this, and the part of the brain that lights up when you have eye movements like this is the parietal lobe and the cerebellum. So by a factor of 10 times, the cerebellum and the parietal lobe are the ones that are most affected by a traumatic brain injury, at least in eye movements. And eye movements reflect kind of the status of the brain. And you can look at this and say, okay, so when I have this machine, and when I use this and I see something like this, I know that what I'm going to do is I'm going to try to work on where is it and the sensory integration for the parietal lobe, and the where am I from the cerebellum, and to try and figure out if that person can be helped as to where they're at in space. So the big conclusion here is this: you can use your visual system to not only diagnose, but to recover from a brain injury. And there are certain targeted exercises and certain eyeglass prescriptions that can shoot signals from your eye, your retina, to different parts of the brain to help them heal. And as I always say, it's never too late to investigate. I don't care if you've had symptoms for years or 2 weeks or whatever. Properly prescribed glasses from a neurooptometrist can be unbelievable in helping you recover from the symptoms that you get from a traumatic brain injury. Here are my resources. I get information from this talk from the College of Syntonic Optometry and from the Neuro-Optometric Rehabilitation Organization. I want to thank everyone for being on this webinar, and if you have any questions or comments, please let us know. Thank you.